In this video, we'll demonstrate how to set up a high flow nasal oxygen device. This is a humidifier and integrated flow generator which can deliver oxygen concentrations from 21 to 95% at flows between 2 and 60 litres per minute. The water chamber enables breathing gases to be warmed and humidified at optimal body temperature of 37 degrees, while the breathing tube incorporates a heated wire to minimise condensation. In respiratory failure, a patient's peak inspiratory flow rate can be as high as 120 litres per minute. Low flow devices, such as a Hudson mask, are insufficient to match this flow rate, resulting in entrainment of room air. This dilutes the effective oxygen concentration which reaches the lung. So, high flow nasal oxygen better matches a patient's peak inspiratory flow rate and reduces the work of breathing.
So first of all, we're going to connect the wall-mounted oxygen supply. Then we're going to take the electricity supply and connect that and plug in the high flow. Next, we'll remove the red decontamination tubing because it should be through a process of decontamination, and when I switch on the high flow, it will go through a self-check, and I'll also get the traffic lights that will show and indicate that it's ready for use. While it's doing that, I'm going to take the water chamber and I'll connect the adapter to the top, press down quite firmly so that it's well connected. Then I'm going to depress the finger here and slide it in, all lined up. Next I'll take a bag of sterile water for inhalation. I'm going to spike the bag here with the tubing. Make sure it's tight, the connection, and then I'm going to hang the bag here and just look to ensure that it's starting to fill with water, and it's going to fill to the water level here. Then I'm going to take the heated wire oxygen tubing and it connects on the top here. There's two little prongs that you'll line it up with. You'll pull back in the blue part, press down once you're lined up quite firmly, and then push down the blue section of the tubing. You can hang this up here in a little holder to keep it clean while you do the last part, which is take the bit of green oxygen tubing, and you want to connect that onto your oxygen flow meter here at the top, and then it connects here on the bottom of the high flow here on the little nipple. And the next thing you want to do is just set it on the actual settings. So you can use the flow meter here to set your oxygen, and you'll get a display here. So say we'll put it on at 50% oxygen, so we turn this up. And the other part to adjust is just the temperature, and you want to set it to 37 degrees body temperature. So we're just going to change this oxygen over. We're going to take this mask off like we spoke about. And this is this special oxygen that's going to help you with your breathing. So this is going to go inside your nose. How does that feel?
It's fine.
Is that alright? Might be a bit of a funny sensation at first. And I'm going to clip this onto your gown so that the oxygen tubing doesn't pull or anything. Is that okay for you?